Indometacin, also known as Indomethacin, is a nonsteroidal anti-inflammatory drug commonly used as a prescription medication to reduce fever, pain, stiffness, and swelling from inflammation. In this video, let's found. What is Indomethacin? What is Indomethacin used for? Contraindication. What are the side effects of taking Indomethacin? How does Indomethacin work? How to use Indomethacin? What is Indomethacin? Indometacin, also known as Indomethacin, is a nonsteroidal anti-inflammatory drug, NSAID, commonly used as a prescription medication to reduce fever, pain, stiffness, and swelling from inflammation. It works by inhibiting the production of prostaglandins, endogenous signaling molecules known to cause these symptoms. It does this by inhibiting cyclooxygenase, an enzyme that catalyzes the production of prostaglandins. It was patented in 1961 and approved for medical use in 1963. In 2020, it was the 320th most commonly prescribed medication in the United States, with more than 800,000 prescriptions. What is Indomethacin used for? Oral Indomethacin is indicated for symptomatic management of moderate to severe rheumatoid arthritis, including acute flares of chronic disease, moderate to severe ankylosing spondylitis, moderate to severe osteoarthritis, acute painful shoulder, bursitis and/or tendinitis, and acute gouty arthritis. Intravenous Indometacin is indicated to induce closure of a hemodynamically significant patent ductus arteriosus in premature infants weighing between 500 and 1750 g when after 48 hours usual medical management, example, fluid restriction, diuretics, digitalis, respiratory support, etc., is ineffective. Contraindication. Indomethacin is contraindicated in the following patients: concurrent peptic ulcer, or history of ulcer disease, allergy to Indomethacin, aspirin, or other NSAIDs, Roux-en-Y gastric bypass and gastric sleeve patients, patients with nasal polyps reacting with an angioedema to other NSAIDs, children under 2 years of age, with the exception of neonates with patent ductus arteriosus, severe pre-existing renal and liver damage. Side effects. Some common side effects of Indomethacin are headache, dizziness, vomiting, diarrhea, constipation, ringing in the ears. Indomethacin may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. Pharmacodynamic. Indomethacin is an NSAID with analgesic and antipyretic properties that exerts its pharmacological effects by inhibiting the synthesis of factors involved in pain, fever, and inflammation. Its therapeutic action does not involve pituitary adrenal stimulation. Indometacin primarily works by suppressing inflammation in rheumatoid arthritis by providing relief of pain as well as reducing fever, swelling, and tenderness. This effectiveness has been demonstrated by a reduction in the extent of joint swelling, the average number of joints displaying symptoms of inflammation, and the severity of morning stiffness. Increased mobility was demonstrated by a decrease in total walking time and by improved functional capability seen as an increase in grip strength. Mechanism of action. Indometacin is a nonspecific and reversible inhibitor of the cyclooxygenase (COX) enzyme or prostaglandin G/H synthase. There are 2 identified isoforms of COX. COX-1 is universally present in most body tissues and is involved in the synthesis of the prostaglandins and thromboxane A2, while COX-2 is expressed in response to injury or inflammation. The analgesic, antipyretic and anti-inflammatory effects of Indomethacin as well as adverse reactions associated with the drug occur as a result of decreased prostaglandin synthesis. Its antipyretic effects may be due to action on the hypothalamus, resulting in increased peripheral blood flow, vasodilation, and subsequent heat dissipation. The exact mechanism of action of Indometacin in inducing closure of a patent ductus arteriosus is not fully understood, However, it is thought to be through inhibition of prostaglandin synthesis. Half-life. Indometacin disposition from the plasma is reported to be biphasic, with a half-life of 1 hour during the initial phase and 2.6 to 11.2 hours during the second phase. Dose. The dose of this medicine will be different for different patients. For oral dosage forms, capsules or suspension. For acute gouty arthritis. Adults, 50 mg mg, 3 times a day. Your doctor may decrease your dose as needed. Children 15 years of age and older, dose is based on body weight and must be determined by your doctor. Children younger than 14 years of age, use and dose must be determined by your doctor. For acute painful shoulder, bursitis or tendinitis. Adults, 75 to 150 mg mg, per day, divided into 3 or 4 equal doses, and taken for 1 to 2 weeks as determined by your doctor. Children 15 years of age and older, dose is based on body weight and must be determined by your doctor. Children younger than 14 years of age, use and dose must be determined by your doctor. For mild to moderate acute pain. Adults, 20 mg mg, 3 times a day, or 40 mg 2 or 3 times a day. Children, use and dose must be determined by your doctor. For moderate to severe ankylosing spondylitis, osteoarthritis, or rheumatoid arthritis. Adults, 25 mg mg, 2 or 3 times a day. Your doctor may increase your dose by 25 or 50 mg per day, as needed. However, the total dose is usually not more than 200 mg per day. Children 15 years of age and older, dose is based on body weight and must be determined by your doctor. Children younger than 14 years of age, use and dose must be determined by your doctor. Safety advice. Indomethacin has 2 potentially serious side effects for the fetus. It can cause a reduction in urine that the fetus produces, and it can change the way the blood circulates through the fetus's body. If the fetus produces a reduced amount of urine, the amount of amniotic fluid in the womb may also be reduced. That's all the information about Indomethacin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.